So let's jump into some of the great questions that were asked. What's the best terpenes for motivation and focus? You had a chat about focus when we began. Lisa, tell me a little bit about this.
That's pretty funny. I was just saying one of my favorite strains for motivation and focus. And so some terpenes that you want to look out for are pinene and limonene. Those are the two that are going to give you a nice energy boost. And pinene specifically, we've been told is great for an energy boost, but with that focusing effect that you're looking for. So I would say those are your two best bets to try out.
And I do have to say, thank you very much for asking the question correctly. What are the best terpenes? Because the terpenes bring you the medical value, not the strains. And if you focus on the terpenes, it'll get you the relief that you're really looking for, and that's the way to go. And again, in the dispensary personnel have been schooled and have information on this. So please feel free to ask them. Tell them what your condition is. Get a consultation. Go from there. So there has been. This is what are the known differences between CDT and BDT? That sounds for cannabis-derived terpenes and botanical-derived terpenes. Do you want to take this? Or you want me to take it, Lisa?
Take this one. So cannabis-derived terpenes are terpenes that were created from the cannabis plant and then were extracted from a cannabis plant. Sometimes that means the hemp plant that doesn't have THC. Sometimes it does mean the regular cannabis plant that does have THC. Botanically derived terpenes are terpenes that are extracted from fruits and flowers, most commonly. Now, on the chemical level, they are the same. Structurally they're the same, but some
Sure.
people find that they respond better to cannabis-derived terpenes. Some people find that botanically derived terpenes do the trick. And so, really, it's just a matter of what your body is responding to and what you prefer.
Sure. I mean, naturally, you'd like to stick to as many CBTs or cannabis-derived terpenes as possible, but there are also times that some of the dispensaries will enhance it with botanical-derived terpenes because, again, we're trying to engineer this for a outcome to address somebody so they can get their condition, the relief from the condition that they're looking for. And I think that's really, really important. But you pointed out something important. They're the same whether they're CBT or BDT. It's the same terpene. It's just one's derived from cannabis, one's derived from a botanical product that's out there. Well, the next question, which is a great question. Once a patient gets a medical card, who prescribes the dosage? Lisa, you want to take this one?
Well, like as we were saying throughout the presentation, you may get some additional recommendations, but really when it comes to actually using the product, you're in control. And so if you find that you need a little more, you can have a little more. If you find you need a little less, you can have a little less. Just follow those dosing guides that we covered through that webinar that Mark went into, and you should be in a good spot.
Yeah. So I might want to explain what we're talking about here. When you get your medical marijuana card, when you go to a doctor, they'll say take 2 pills and call me in the morning. What the doctor's really doing is the doctor's giving you the lowest possible uh, dosing, trying to see if it works. And of course, if it doesn't work, you got to call him back and you've got to get your prescription adjusted. You go through this whole process. In the case of cannabis, there are different routes of administration. It's more than just a pill or a shot. You can take it with respect to tinctures, orals, like we mentioned, opticals, topicals, and flower, or vaping, smoking. Now, the other issue comes into the fact how much do you take as far as dosing? The medical cannabis doctor really doesn't know because it's very dependent on your body. Candidly, so is pharma drugs, but they give you the minimum amount. In the case of cannabis, you have a number of different options because based on the terpene profile, it'll give you or recommend the product that you're going to be using. Now, I recommend that you start with something, as we said, start low and go slow. So that when you say, what's the prescription is take, for example, a tincture drop, take a quarter of that tincture drop in the morning, take it for a day or two and see if you're getting any relief or if you have any negative reactions. If you don't, increase that to maybe half a tincture drop, half of that eyedropper, and try it in the morning and the evenings. If you're not getting any relief, then go to using it twice a day, once in the morning, once in the evening. If you keep increasing the amount and the timing, at some point you'll begin to feel relief. Once you feel that relief, then what you're going to want to do is know that that's your therapeutic dosing level. But as you keep increasing it, maybe you go to a full eyedropper versus 3/4 of an eyedropper, you'll begin to feel brain fog. You'll begin to feel not as comfortable. And so that's where you've actually gone past your therapeutic dosing level. You've got into that unreleased, you get to that area where you're uncomfortable. So go back to that half, that 3/4 or a half an eyedropper, or and try that. So by finding that you've really dialed in the amount of THC that you're going to be able to use, and then you can increase the amount of CBD. That's where you hear about ratioed products. Ratioed products means the first number is, for example, 4-to-1 means 4 CBD to 1 THC. So when you get that 1-to-1 drop, you find out where your tolerance is to THC. You might try a 2-to-1 or a 4-to-1 or an 8-to-1, because as you increase the CBD, it also has some effects on your body that can help you, but has less negative side effects. And so, for example, I use a 4-to-1 in my particular regime. My wife uses a 20-to-1 because she's going after anxiety and stress, and she's extremely sensitive to THC, less so than myself. So, who prescribes your dosage? It's you. And who's the one that lets you know it's the right dosage? It's your body. And I think that's really, really important. People get a little nervous about this, but to be candid with you, when you're in control, you know what works and you know what doesn't work. After you use cannabis for a week or two, you realize this is really the best way to go, because I can really dial in exactly how I feel. Using a pharma drug, you've got to go through a doctor or a doctor's practitioner. It's very hard to get that exact dosing level down in many cases at first if the minimum amount doesn't work. So again, recommendations are important. Where do you find out where to start, whether it's a quarter of a gummy or it's a tincture drop? Talk to your medical marijuana doctor. They'll give you some guidelines as to where to go as far as tinctures and that type of thing. And then talk to your dispensary. Go get a consultation. They'll help you, guide you through this particular process, and get more than one consultation. There's nothing wrong with that. So I hope that helps a little bit. The next question is: the dropper is milliliters, but the instructions are sometimes measured in milligrams. Which do I follow? I think what you want to follow is milligrams. Your thoughts, Lisa?
Yeah, I would also say follow the milligrams. And so the milligrams is going to be referring to the potency of the THC. And so
Mhm.
if it says, 1 drop equals 5 milligrams, then you only want to have 5 milligrams of THC, then you would only be taking 1 drop in that instance.
Right.
It can be a little tricky. Just for reference, there are about 20 drops in a single milliliter. And so that might help you dose it out a little bit. And also, with the products, definitely ask the dispensary or the store that you're purchasing them from, just to be super clear. Because tinctures in that way with the milliliters versus milligrams can be a little confusing at first. But once they point out what the serving size is and how many milligrams of THC are in that serving size, it should be a little bit easier for you to dose.
The milligrams are the strength. It's how much cannabis is
Yes,
in there. The milliliters is the
is
actual
the liquid.
volume of the liquid itself. So think of it like a cocktail. You can order a drink, you get one shot in that cocktail, maybe an 8-ounce glass, but you got one shot in it. But then again, if you double the shots, you have double the shots, but you still have the same amount of milliliters. It's twice as strong. So what you really want to pay attention to is the milligrams, and then that'll actually tell you how many milliliters you should be taking. I hope that helps a little bit. Please explain the basics of distribution of milligrams between the different methods used. I think what they're meaning is, how do you figure out the milligrams in the different products that are there? And I think the COA helps you figure that out.
Yeah, the COA will help you figure that out. And that is one reason why edibles and tinctures are so popular, is because it's a lot easier to understand how many milligrams you're putting into your body versus an inhalation method like vaporizing or smoking. In that case, it's a little tricky to know how much you're actually inhaling in the moment. And in that case, you would just want to really take into account the total amount of milligrams from the flower you're utilizing, and then how many serving sizes you're breaking up it at
Mhm.
home. That's really tricky. Most people don't go that long. They usually just go off of how many inhales it takes for them to feel the effects they're looking for. Because again, measuring those milligrams of what you're inhaling with an inhalation method is tricky. Much easier to measure the milligrams on a fine level with an edible or a tincture.
Yeah, and I think learning how to dose or beginning with medical cannabis using edibles is a good way to go. Only thing about that, the reason I recommend tinctures versus edibles is because you get it almost an instant within a half hour, you have feedback as to if it works or it doesn't work. Where when you're using edibles, it may take as much as 2 hours, and that requires a lot of patience to be able to go through that and be able to get that down. So it just depends on your patience level as to which is the best way to go, in my opinion. Um, okay, next question is, what's a good dose of edibles or smoking weed to sleep 6 hours and be able to wake up for alarms? So I'm going to actually break this question into two parts, and Lisa, maybe you can help me with this. First of all, there's edibles, and then there's vaping or smoking weed. In the case of edibles, when you take the edible, it could take anywhere between 30 minutes to 2 hours to work, but it will work anywhere between 8 to 10 hours. Could be as much as 12 hours. So when you want to sleep at night, an edible is the best way to go. For example, I am a chocoholic, and I usually take chocolates about an hour before I go to bed. And then when I go to bed, I'm sleepy. I can sleep through the night, and I get my 8, sometimes 9 hours of sleep because of the fact that the edible works over that period of time. Now, let me separate that from smoking weed. If you smoke a vape pen or you take smoke a blunt, that's not going to last for 6 hours. That's going to probably last more for 2. So if you smoke a joint just before bed to fall asleep, it will help you fall asleep, but it will not keep you asleep. And I have to tell you, whether you're using smoking or edibles, after about 3, 4 hours, there should be no problems waking up for alarms. In other words, as you get to the end of that cycle, like if you take an edible, it's going to last 6 to 12 hours, mainly about 8 to 10 on average. You'll find that you won't have much trouble waking up. At least that's been my experience. Your thoughts on this, Lisa? Because I want to separate the edibles from the smokable for a second and talk about the time frames, whether you're going to
Yeah.
sleep for 6 hours or longer.
Yeah, and so I would say the thing that makes this question particularly unique is the 6 hours, because most of the time people are looking for that 8 to 9 range at night. And so I would say if your biggest problem with sleep is falling asleep, then smoking might be a good option, and it might be just enough to keep you asleep for those 6 hours. Maybe not, much longer than that, especially if you don't have problems with arousal in the middle of the night. But if you do have problems with waking up a lot in the middle of the night, then yeah, a low dose of edibles is probably going to be your best bet. And don't be afraid to combine these two methods. So, for instance, if you find that smoking just a little bit gives you that onset of sleepiness, but then the edibles help keep you asleep, then take a couple puffs, eat a chocolate or two right before you lie down, and that might be the perfect routine for you.
And that's a perfect combination. The smoking of the weed will help you fall asleep. The edibles will help you stay asleep. That's really out there. And I do have to tell you, I suffer from the male affliction of having to wake up in the middle of the night and use the restroom. I do welcome to being a senior citizen and being male. And I have to tell you, I go back to bed and fall right asleep when I'm using my medical cannabis product. When I have that edible, I have that chocolate just before I go to bed. I have no problems waking up, going to using the restroom. I have no problems falling back asleep. And to be candid with you, I have no problems waking up in the morning. So
Mhm.
that's really, really important. I have a couple of grandsons that I have to take to school sometimes, and my regime is normally not waking up at 5 and 6 in the morning, but I'm able to, and I don't find any negative to that.
Nice.
Uh, but next question, good tech question, and Lisa, one that you might want to tackle. What's terpenes for sleep and anxiety?
Two of the ones that I would say are going to be really great ones to start with are linalool and caryophyllene or caryophyllene, depending on how you want to say that.
Mhm.
Those are two of the best because they're really great for anxiety relief.
Mhm.
And that anxiety relief is going to really help our minds and in some cases our bodies really unwind and get ready for sleep. And it's really soothing and relaxing. So a lot of those indicas that you see, a lot of those really relaxing strains will be high in linalool and sometimes caryophyllene as well.
Mhm. Yeah, good answer. Okay,
Yeah.
this is a really good question. As a caregiver, I've been asked and observed some of the forms of depression in medical cannabis patients. What does that depression come from a side effect? Now, cannabis is either uplifting or it's relaxing. There are times when people can really get depressed. It could be a side effect of it, but I think more than being a side effect of it, it's really the question of, do they have the right terpene profile? Your thoughts on that, Lisa?
I agree. They might not be utilizing the right strain. If they're feeling really down and sort of listless after medicating, they might be wanting to look for something a little more energizing. You know, something with that pinene and limonene that we talked about in the beginning of the Q&A. Those kinds of strains might be a good option where that same THC is going to provide, you know, whatever medical relief they're looking for, but having that pinene and limonene might give that mood boost and energy boost to sort of prevent that depression feeling.
Right. And in most cases that I've seen with patients that I work with that have a depression situation, I look at when I go back and I look at the type of cannabis they're using, the terpene profile doesn't match or isn't a close enough match to the condition that they have. And by adjusting that, it's really got rid of most of that problem itself. Again, it should be cannabis has uplifting capabilities. And if you're taking a product that isn't, so let's talk about sativa and indica for a second. Sativa means uplifting.
Mhm.
Indica means relaxing, or in the couch is what they say. I think if you're looking for someone's taking a indica product when they're in kind of a depressed state, it could look like a side effect. Your thoughts, Lisa?
I agree. And, you know, sometimes people are trained that indicas for some reason have better pain relief potential, where that's not necessarily true. And so maybe they were told they should look for indicas because it would help them with whatever condition they had.
Right.
But maybe actually a sativa is something that's going to fit the bill better for them.
Right. And I will second that thought. I had I had knee replacements, both right and left knees. And when I had my left knee replacement, I used medical cannabis for pain relief. And I found that the indicas, especially in the afternoons and the evenings, were very good for pain relief. In fact, they were probably better than the uplifting product I used in the morning. So don't worry about whether, and by the way, when they say indica and sativa, that means there's leaning towards being relaxed or leaning towards being uplifting. There are very few pure sativa and indica products anymore because of the work that's been done to create cultivars or create products that really address particular conditions. So that's out there. Let's see what else we have for questions. Um, what can I use for pain for neuropathy and osteoarthritis? I can take this, or do you want to take it, Lisa?
You go for it.
Okay. Neuropathy and osteoarthritis. Let's start with neuropathy. Neuropathy is something where the sheath in your on your nerves is being removed, and so the best for that is using a high CBD based ratioed product. You still need THC to address the pain, but having something that's a 2-to-1, a 4-to-1, maybe even a 9-to-1, depending on your body, is really going to help quite a bit. And so I think that's the ratio, is the type of product to take a look at. And also with osteoarthritis, again, a high CBD ratio product is going to help quite a bit. Now, the question is, what's the best method to take it? Because it's not a matter of just having the right ratio that's out there. What's the best way to take it? Now, I have found that topicals, for example, work very well, especially transdermal topicals will help quite a bit with this. I know that when I'm still getting a little arthritis in my hands, welcome to age. I use a topical and it works great to really help me. It works almost immediately. And interestingly enough, once that inflammation is taken down, it'll last during the day. So I would say if you take a look at neuropathy, um, look at a high and osteoarthritis, use a high CBD based product. I will also refer you to our YouTube library. I did about 3 weeks ago a webinar on neuropathy, and you might want to take a look at it. And then also we had one on arthritis earlier this quarter, so you might want to take a look at both of those webinars. It really dials right into the products that you may want to take a look at. Your thoughts, Lisa?
No, I completely agree. High CBD products are definitely going to be a great place to start. And
Yeah.
don't overlook those topicals. Even ones with, you know, those lotions and salves, even with those with high THC, you can utilize them during the day without any sort of intoxication. So it gives you a really great option.
Yeah. Good question is the next one. Will insurance cover marijuana or do we pay out of pocket? Unfortunately, you pay out of pocket. Cannabis in the United States, from the federal government standpoint, is listed as a Schedule One drug. To be candid with you, the insurance companies use that as their out to not have to pay for medical cannabis. And hopefully, if we can get a change from a Schedule One drug, we can start getting them to participate in the party. But they want to have you head you into the pharma area and not necessarily something that's healthier for your body. So unfortunately, insurance doesn't cover marijuana. Now there are insurance companies that are being created. There's one called Canopay, And what we'll do is in the follow-up to this webinar, you'll get an email. It'll tell you, it'll give you a copy of the actual presentation itself. It'll give you a link to the video so you can watch that. It'll give you some other material like the dosing chart, excuse me, the terpene charts and the routes of administration. They will also include in that a link to Cannabis. They actually have a program that you can sign up, and they'll actually, it's like a AFLAC type of a program. It's an add-on to your medical program that will allow you to pay for your medical cannabis. So there are companies starting up that way, but the traditional companies do not cover cannabis. These are kind of startup companies. One question is how to navigate TRICARE health insurance covering medical marijuana. I am really not familiar with them. TRICARE, I'm not familiar with them. And again, they're stating again, because it's illegal, they don't want to cover it. Again, these insurance companies use every opportunity they can to get out of paying for something, and they're using the Schedule I drug as that. And unfortunately, I don't know any way to navigate it other than potentially paying out of pocket or get a hold of Cannabis and find out what they have to say. Those are the only two options that I really see. I wish there was a better option, but do me a favor, don't shoot the messenger. I'm just giving you the facts the way they exist. What does the future hold for terpenes? What's the next milestone for cannabis? Terpenes have an incredible future. We have really discovered the medical benefits of them. We're discovering more of the terpenes and more of the medical benefits. I see terpenes being really the center stage of cannabis in the next 5 years. Hence why you hear about cultivars versus strains. People talk about the cultivars because that's the cannabinoid and terpene and flavonoid combination to address a certain particular situation. Think of the cannabinoid as think about like a flower. The cannabinoid opens up the flower. What it deposits in it is the terpenes and the flavonoids that give you that receptor, the relief it needs from the particular condition that it's addressing. As we learn more and more about terpenes, we learn which terpenes address different conditions. You'll find more cultivars being made using those terpenes, meaning combination of strains, cannabinoids, and everything all together to be able to address that particular situation. So I see this as really, we're just on the beginning of terpenes really taking off as being mainstream. And again, that's going to be using the term cultivar as well as terpene. Your thoughts, Lisa?
I completely agree. And this is one thing that's really one of the things I'm proud of working at INSA is that right from the beginning, we recognize that terpenes do contain a lot of the medicinal benefit of cannabis, along with that THC and CBD and other cannabinoids. They're just as important. And so, we've sort of been leaders in the industry for making sure that people are aware of this, and our education is very much wrapped around this. And so, yeah, we think that as more and more dispensaries and more options open up, the terpenes are going to be more talked about and more key when it comes to choosing products.
Yeah, I have a terpene project I've been working on, and hopefully it'll get out early next year. That just helps people figure out what terpenes to use and which strains to use, or excuse me, which cultivars to use. Terpenes are really going to be the future, and they are the future. They've been, let's just put it that they've been there for a long time. But as we learn more about them, it's kind of like we walked over this mountain and we found this valley, a beautiful valley to live in. That's what the terpenes represent. We're going to go discover that valley of terpenes and find what's out there. So Keith asked a great question, Lisa. Why doesn't INSA deliver?
We're working on it. The question is, why don't you deliver yet? We are going to hopefully be having plans to deliver in Florida. It's just that we're still sort of settling into Florida right now, and we are having that in our plans.
Right.
Sorry,
Yeah,
we don't have it yet, but soon.
I'd say probably within the next couple of months or next couple of quarters, you'll be able to get delivery. And I know getting delivery is really, really important for a lot of patients.
Yeah, and you can sign up on our site. If you sign up to become an INSA insider, then we'll give you emails and texts that would definitely let you know when that program is going to be starting.
Yeah, that's good. That's a good input. Margarita asked a question. Thank you for the presentation. Would it be possible to get a copy of this presentation so we can use it as reference? The answer is absolutely. Again, you'll get an email follow-up to this particular webinar. In there will be a link to what they call a flipbook presentation. You'll be able to look at it. You'll be able to download it. You'll be able to print it if you need to, the charts and things. And so you'll be able to get a copy of that through the flipbook. If for some reason that you missed that email, or if it's in your spam folder, you can go to our website and look at our website. You'll see that we have a whole library that's out there that you can go out and you can pick up this particular. You can look up each of the different webinars that we're given, and it'll give you all of the links to the videos, to the presentations, and all the supporting material. So thank you, Margarita, for that question. Um, Margarita also asked a question that says, I joined late when you were talking about how long to wait before taking the next dose. When taking a sublingual or gummy, how long should I wait before taking in another dose? Now, taking another dose of a sublingual and taking another dose of gummies, there's a different time frame. Lisa, you want to explain that?
Yeah, I would say when it comes to sublingual, since they do tend to take effect faster, there's a little less risk of you over medicating. And so I would say, 45 minutes, if you want to be extra safe, an hour is probably going to be the maximum amount of time that you can go in between those sublingual drops. With gummies, you're going to want to wait a full 2, even 2.5 hours for some people before you have more. And again, this is only until you start to understand what dosage works best for you. You're not going to have to go this little creeping way every single time you use cannabis. It's just until you figure out what dosage is right.
Yeah, and some people have a higher tolerance, for example, to THC. I
Mhm.
know I do. I don't have to wait 2 hours, okay, but I definitely wait more like 30 minutes to 45 minutes in my particular case. Now, in the case of my wife, who is highly sensitive to THC, the 2 hours is definitely something that we didn't follow because we don't want to do is don't want to get into an area where she's feeling uncomfortable, but we do want to address and provide the relief that she's really looking for. So again, that dosing chart that we had, which you'll get as a follow up is it will help you quite a bit in figuring out how long and give you a good guideline for that. Keith asked a good question. What do you have to do to work in a dispensary? What does the state want, et cetera, et cetera? I think when you look at working at a dispensary, it's not only what the state wants, it's what the dispensary wants. Lisa, that's right up your alley.
Yeah, the state definitely has some regulations when it comes to who we can hire. We have to do background checks. I know in Massachusetts, at least, I'm not 100% sure if we do those in Florida. But you just apply. We really like people who have retail experience, have really great interpersonal people skills, and people who like to learn about cannabis and talk about cannabis. If you have all of those things and relevant work experience, then definitely apply. If you go to insa.com/careers, I believe, is where our most up-to-date postings will be. And also if you go to LinkedIn, LinkedIn has all of INSA's postings.
Yeah, I think it's important to point out you don't have to have a lot of medical cannabis experience to apply for a job and get a job at a dispensary because you, for example, inside the dispensaries will train you on medical cannabis. In fact, sometimes it's an advantage to take someone who doesn't know cannabis and train them rather than somebody who's been, let's just say, a recreational user for 10 years, because it's recreational use of cannabis and medical use of cannabis is night and day. It's very different. Your thoughts on that, Lisa?
Yeah, what really matters the most is, are you going to follow all of the things that makes INSA INSA? Are you going to take that time with each and every patient to make sure that their questions are answered? Are you going to do it in a kind and thoughtful way? Those are more important than necessarily knowing everything there is to know about cannabis right now. It's my job to teach all of our, retail employees what they need to know, and we give you all the tools you need to succeed in that area for sure.
Sure. So don't be shy if you don't know cannabis.
Not
If
at
you
all.
have a good bedside manner, if you know how to work
Yes.
with people, believe me, what you're going to be working with are people that have medical conditions, and sometimes they're stressed. I'll be candid with you. When we started doing medical marijuana seminars like 7 years ago, and we did them in person, we had actually seminars we we were shocked to find I know that a lot of the people where we put on the seminars, a lot of the hotels or a lot of the libraries thought that there would be this crazy group of people showing up. What they found was I have to be able to have wider aisles because we have people with wheelchairs, we have people that have handicaps, we have people that have medical conditions, and they're looking for relief. What they're looking for is someone who has the bedside manner to be able to really listen to them and really be able to provide, clearly communicate and provide the information that they're looking for. And I think that's the most important aspect of somebody who works at a dispensary. Your thoughts, Lisa?
I completely agree. I do.
Okay, great. Let's run to the next question. Should I eat something before taking an indica capsule and a CBN capsule before bedtime? I do think that having something in your stomach really helps. So I would say the answer is yes. And your thoughts, Lisa?
I would say definitely. It doesn't have to be anything big, but something with a little bit of fat especially, would be a good idea to have before bed. So even if it's just a slice of toast with some thickly spread butter on there, that would probably be enough for the,
Sure.
medication to grab onto, because that's why you want to do that. THC and CBD and all of that, they grab onto the fat cells in our molecules in our body, and that's what's able to be processed. And so always a good idea to have a little bit of food before.
Yeah, cannabis loves fats, so there
They
you go.
do.
Yeah, but like you say, you don't have to eat a full meal, but I think having a little snack isn't gonna hurt you at all. And I do want to point out all the way on this slide, the YouTube channel, Marijuana Aware, has literally over 100 different videos on medical cannabis and a lot of different topics. Please consult that. It'll help you be able to look up and find different information. You'll find videos by themselves on the topic. You'll find videos on the webinars that we did. Then you'll find videos on just the questions and answers from the webinars, because there's a lot of material, that good information that's in those as well. So please feel free to go to our YouTube channel, and I'm going to throw in a shameless plug to subscribe and like. We really appreciate that. On to the next question we have here. Ronald asked a great question. What would the best combination to help with the cravings? I have prescriptions, particularly hydrocodone, and I'm trying to end my relationship with this addiction. And the second part of that question is, I am using drops, the blend I am using, what I am using does not help me with my cravings. Let's break this down into two different ways of looking at it. The reason using hydrocodone is to be able to address, for example, pain. If you look at the medical reference for hydrocodone, it really talks about not using it for more than 3 weeks, 2 to 3 weeks. More than that creates an addiction. An addiction is where your body has to crave it. It almost requires it. That's what the opioid thing was all about. Hydrocodone is the same thing. Oxycodone is the same thing. Heroin's the same thing. It creates an addiction in your body. It has to do with the way it affects your receptors. Cannabis can be an exit drug, and let me explain to you how that works. If you're looking at relieving the pain, cannabis works very effective at pain. And I, for one, will testify to that. The herniated discs in my neck, on a scale from 0 to 10, can be a 9. And I actually have 2 herniated discs in my back that are no picnic, but compared to my neck, it's not any fun. I have been able to, since my auto accident 6.5 years ago, got my pain level down to below a 1. And I live in that particular area. Now, when I go to sleep at night, I have found that by using some chocolate before I go to bed, I wake up in the morning with less pain, maybe a 3 or 4. And then I use a vape pen when I wake up in the morning. It gets rid of my pain literally within 2 to 3 minutes. And then I use a tincture drop to take me through the morning, gummies and tincture drops in the afternoon, and the same thing in the evening, and then back to my routine with chocolates. Now, I can get rid of my addiction based on pain. In other words, if I have no pain at all, it makes it a lot easier. Now, from the addiction to hydrocodone, as you get rid of the pain, you'll have less of the cravings or less of the desire to use hydrocodone, because the reason that you're using it is gone. But you mentally have to put yourself into a state of understanding that it's like Pavlov's dog. If I ring the bell, I get the treat. Well, when you took hydrocodone, you got rid of your pain. But now you can get rid of your pain, but you don't have to ring the bell. You don't have to go and take hydrocodone. It's important that you train your body and that you train your mentality for that. That's really breaking an addiction. That's really there. And it's hard to do. I'm not saying it is easy to do. It is very hard to do. And I'd get some counseling on that. I'd talk to your doctor about it. And I'd talk to a counselor about that, because they can help you with this quite a bit. They want to get you off of these drugs as much as you do. But the question is to find the right person to help you walk you through that. Your thoughts on that, Lisa? And by the way, when it says I'm using drops to address it, I use tincture drops, but I also used a vape pen. And the reason I did that is because the vape pen worked right away to get rid of my pain, and the tincture drops kept the pain away. If I used the drops, it would take, in my case, 20 minutes to 30 minutes to work. And that would, again, get me tempted to go take something. I was put on Percocet, and I was put on hydrocodone when I first had my auto accident, and I was like a zombie. And I have to tell you, I did find medical cannabis got rid of the pain. I did find it helped me, but I mentally, to break that addiction to hydrocodone, like I say, I rang the bell, I got less pain. When I found out I had less pain, I just had to tell myself I don't have to ring the bell. Your thoughts on that, Lisa?
Yeah, well, you totally said one of the things I was going to recommend is get yourself a vaporizer, particularly. Not only is it going to take effect a little bit faster than the drops potentially, but there tends to be, they tend to have a higher potency. And so you get more of that CBD and that THC in there.
Mhm.
Also play with your ratios. I know somebody very intimately who has gone on a very similar journey where they were trying to exit out of using these particular drugs. And they started off trying a 1-to-1, then moved to a 2-to-1, and found that that double the amount of CBD to THC, that 2-to-1, was their happy place.
Yeah.
And so definitely play around with those different cannabinoids. You know, if you find that CBD is helping you and you try a 1-to-1, go ahead and try that 2-to-1, that 3-to-1. Or conversely, if you find that it's that THC that is really helping those cravings in your body, then go ahead and move to something that is maybe a 1-to-2, where it has, you know, twice the amount of THC to CBD. So don't be afraid to play with those ratios. That can really be the key in finding where your happy place is going to be, and look for those vaporizers.
Yeah.
They're
And
very strong and they work almost instantly. And it was the vaporizers in the end that has helped a few people that I know of completely exit from, you know, using these drugs. Of course,
yeah,
talk to your doctor before stopping any sort of prescription, though.
right. Don't go cold turkey. Don't take
Yes.
one day and stop the next day. You kind of wean yourself. Take less and less hydrocodone over a period of 2, 3, maybe 4 weeks. Drop your hydrocodone down to as close to zero as you can. You can increase the amount of medical cannabis. Again, as your pain goes away, it makes it easier for you not have to go over and ring that bell, and then you're being able to get that. But it's a matter of go again, not black and white. Take your time to do this. Take it over 2 to 3 weeks, but it does work very effectively. Cannabis is an exit drug, not an entrance drug to these pharma drugs that are out there. And again, I think you're right. The vape pen helps quite a bit. And I have to
Yes.
tell you, vape pens are safe if they've been used by especially if they've been purchased through a medical marijuana dispensary. And they have different types. They have with CBD, CHC levels. They have different ratios. Pay attention to them. I think it makes a lot of sense. If you are going to smoke flower, use a dry herb vaporizer. I highly recommend it for two reasons. You don't get any burnt material in your lungs, and the second is with dry herb vaporizers, you can dial in the terpene temperature. You can set it to heat up to 350, 370, 390, 410. It takes out it focuses on the terpenes and the temperature that the terpenes need to be able to really come alive. I think that's really, really important. So pay attention to that as well. I don't necessarily recommend smoking weed from the standpoint of lighting up a blunt, but I do recommend that you use a dry herb vaporizer. So I hope that helps quite a bit. Anonymous said, I've been on oxycodone 4 times a day since 2013 for neuropathy. Would it be safe to use medical marijuana in conjunction with oxycodone? The answer is yes. And in fact, what medical cannabis can help you do is get off that oxycodone. If you've been using oxycodone since the year 2013, it hasn't been helping your body. Your body needs to be able to really get off that oxycodone to really help itself. Just to say heal. Let's put it that way. But again, it is not. It is safe to do this, but not black and white. You can either, if your doctor is friendly towards medical cannabis or open to it, you might want to work with him or find a medical cannabis practitioner who can help you go between the neuropathy, the current levels that you're using and down. Again, over 2, 3, 4 weeks, cutting down on the amount of oxycodone, increasing the amount of medical marijuana. When you find that your pain is going away, when you find that when you start using more medical cannabis than oxycodone and the pain has gone away, it really helps you be able to realize you're on the right path that's there and you'll know that you're getting there. But again, it's not black and white. Your thoughts, Lisa?
Yeah, the only thing I would add is that unfortunately, a lot of times when you are tapering off of these drugs that your body is physically dependent on, there can be some withdrawal symptoms. And a lot of the times, those really, really high CBD products can help with some of those symptoms. And so that's
That-
something else I would keep in mind.
That's a good point. You get withdrawal symptoms from these pharma drugs, and really the CBD will help with that quite a bit. CBD works more than with the CB2 receptor. There's a number of receptors in the
Yes.
body that it works with. It's almost like a super vitamin. It'll help you quite a bit. And it's also worth noting that some of the side effects from pain and also limited mobility is depression. It goes back to that question that was asked earlier. And so what you'll find is by using maybe people use medical marijuana to address depression, to address that pain. Medical marijuana can help in that particular condition. And again, making sure you're having the right terpene profile will help quite a bit. And I hope that helps to be able to answer that particular question. So, Lisa, we've gone on for quite some time. This has been a rather long webinar. There are some resources that people can look at. I know people say, "How do I get a medical marijuana card?" I think you can get that through the Medical Marijuana Treatment Centers, MMTC here in Florida. They have 25 clinics. They're here to help you. If you're looking for CBD only products, because Lisa, in your case, you handle marijuana products, but you really don't sell CBD products, right?
Nothing that's strictly CBD, no, because all of the plants that we grow have a fair bit of THC in there.
Right. So if you're looking for just CBD products, hemp-based CBD products, we have a store for you, My Botanical Wellness. Why did we create that? Because it has the same testing levels that you find with medical cannabis. And what INSA uses, the same testing levels that are there, but it's for hemp-based CBD. And if you want to look at that as an option, we have that. And naturally, I'd recommend if you're looking at a dispensary, INSA. I think this is something where I had a chance to visit your facility. You go really out of the way for product quality.
We absolutely do, and we're never satisfied. I can tell you just in the 6 years that I've been with INSA, I've seen us improve our methods time and time again. Never because there's a problem, but because we're always searching for, what is going to make our products even better than they currently are.
Great. And I want to also mention, if you have any questions about medical cannabis, if you're looking for advice, let's say, or information on medical cannabis, please check out our YouTube channel, marijuanaaware.com. Lisa, we've covered a lot of information. Do you have any wrap-up thoughts?
Yeah, if you want to talk to us at INSA, we have real people who are available at our customer service department from 9 a.m. to 7 p.m. every single day. So if you want to give us a chat or a call, go to INSA.com, and we're there for, any questions you may have, whether it's about products or how to get your medical card in the first place.
Right. And you don't necessarily have, what's nice about it is you can, even before you get your card, or even if you do have your card, you can do this over the phone. So you don't have to necessarily run down to the actual dispensary itself.
Yeah, that's really nice. Saves you a trip for sure.
Makes a big deal. And of course, the educational part that's out there. Lisa, thank you very much. I really appreciate your insight. More importantly, I'd like to thank everybody who's watching right now. It's been a long webinar. I know we've covered a lot of information. Hopefully, you'll get a lot out of the information that we send you in the email that's there. But our goal is really to help you get your life back. If we just help one person tonight get their life back by discovering medical cannabis and learning how to use it correctly, then we've been successful. And I think that it's something that we hope this has really helped you. So thank everybody for joining us. I want to give a shout out to the moderators in the background, Lisa and Leah. Without them, this doesn't happen, and it makes our lives a lot easier, and hopefully your lives a lot easier. And I want to thank them, and I want to thank also Alyssa for coming up with the idea of doing this particular webinar. I want to thank everybody for joining us, and I hope that everybody has happy holidays.